A wound is a break in the skin, usually at the epidermis. Wounds are usually caused by cuts or scrapes. Different kinds of wounds may be treated differently from one another, depending upon how they happened and how serious they are. Healing is a response to the injury that sets into motion a sequence of events. With the exception of bone, all tissues heal with some scarring. The object of proper care is to minimize the possibility of infection and scarring. Here is how to perform wound dressing. Assess the client's comfort level. Assess the external appearance of the initial and subsequent dressings. Assess the appearance of the wound and drains once the dressing is removed. Assess the client's understanding about the care of the surgical site. For the implementation, gather all the supplies needed for the procedure. Provide privacy. Explain procedure to the client and wash your hands. Apply clean gloves. Remove the dressing and place in appropriate receptacle. Observe the undressed wound. Cleanse around the incision with a warm, wet washcloth. Cleanse the suture line with prescribed solutions. Used applicators should not be reintroduced into the sterile solutions. Remove used exam gloves. Wash your hands again. Set up all the supplies. Apply a new pair of clean exam gloves. Grasping just the edges, apply a new gauze dressing. Tape lightly or apply tubular mesh. Mark initials, date, time on the dressing to validate that the dressing has been changed. Remove gloves and wash hands. Conduct client or family education about the dressing. For the home care, scrapes and abrasions often do not require any more care than washing the area 4 times daily for the first 48 hours and keeping the area covered with a sterile bandage. Deeper wounds and bites will require medical attention. First is to stop the bleeding. If bleeding will not stop, apply a clean bandage to the area and press down on it for 10 minutes. Clean the wound. Water under pressure is the best way to clean a wound. Either a briskly running faucet or a handheld shower nozzle is the best way to wash a wound. The wound should be washed for 10 to 15 minutes. Make sure you remove all dirt and debris. Do not scrub deep wounds or bites. Just wash them out. Lastly, check when you last had a tetanus shot. Here are the importance of wound care. Dressings are important to maintain sterility and absorb blood and serum. Moisture improves the rate of epithelialization. The goal is a state of optimal hydration of the wound margins, not too wet or too dry. Sutured or stapled laceration should be covered with a non-adherent dressing for the first 1 to 2 days to also allow sufficient epithelialization to prevent gross contamination.